Well, our laboratory continues to use models of alternating hemiplegia of childhood that are based on using induced pluripotent stem cells to generate neurons in the laboratory with which we do electrophysiological and other assays to try to learn something fundamental about the disease mechanisms responsible for AHC. In the last year, we focused a bit on trying to understand whether the primary mechanism of the disease is due to haploinsufficiency, meaning the disease originates because simply of the lack of one functional copy of ATP1A3, or alternatively, the disease occurs because the mutation in one of the two copies has a negative influence on the normal copy. And that's something that's very important to understand because it will affect how one might devise molecular strategies to treat the disease. Molecular strategies such as gene therapy, for example. The other thing we've done recently that I've presented at today was we're interested in knowing what the mechanism responsible for the activity of flunarizine. Flunarizine is a widely used treatment for AHC, but we're not convinced we understand why it works. So we're taking a unique strategy. We, as a pilot experiment, which we were gladly funded to do by the French AHC Foundation, we took a pair of patients, both of which were female, both of which had the same exact ATP1A3 mutation, and they both were treated with flunarizine. One of them responded well, the other one did not respond at all. And we generated stem cells from each of those patients, made neurons, and then tested the electrophysiological effect of flunarizine in each set of neurons. And we're still doing the work, but so far what we have observed is there seems to be a cellular basis for that, at least contributing to the difference in flunarizine response. The cells we got from, or the neurons we made from the patient who did not respond to flunarizine showed a lower sensitivity to the drug. In other words, the drug had less effect on the neurons than the neurons from the patient who was responding to flunarizine. And so the next step for us over the next several months to a year will be to look at what are the targets of flunarizine, and can we assay those as a candidate for to explain the difference. And I think this is just one strategy to try to understand what is the mechanism of flunarizine's action in AHC, because if we can understand that better, maybe we can devise a better strategy with the same target in mind to alleviate symptoms in the disease. So I presented today the pilot study. Our next phase of the work will be to look at individual targets of flunarizine, such as calcium channels and sodium channels, to see if they are, in their properties, are different between the responding and non-responding patient cells. And then a big step forward is going to be to gather additional pairings of patients with comparable mutations for whom there's a response in one and a non-response in another, so we can validate this observation. I think this is going to go on for a little longer, probably another year and a half, before we can feel confident in the results. So one of the things discussed this year was an update on a new project that started about a year ago, which is to try to develop a viral delivery system to put back into the brain normal copies of ATP1A3. This so-called gene therapy approach is very exciting, and others at this meeting gave updates on their work. We're very interested in collaborating with those groups to explore whether we can rescue the cellular defect that we're observing in neurons from patients with AHC by using these viral delivery methods. So I think that gene therapy is really a very important thing to explore right now. That kind of therapy has worked well in other childhood neurological diseases, and even to the point where new molecular therapies have been approved for use in humans in the last couple of years. So I think there's optimism around looking at gene therapy as a vehicle for treating AHC. But there are a lot of hurdles, and I think we all have to be realistic that in the best scenario, these things take years to develop. But this is a community of scientists that wants to work together to help move this forward. And I think most of the people at this meeting came to this meeting because they're interested in collaborating with other scientists and also learning from the parents and families of children with AHC what is most important. And from that, we derive a lot of motivation.